Well, good afternoon, everybody, and welcome. My name is Linda Hughes. I'm the chair of Alberta Health Services Board, and I'm happy to welcome you all to our final public board meeting of 2016. Everybody has their agenda. Could I ask somebody to move approval of the agenda? Hugh, seconded by Glenda. Thank you. All in favor? Great. Declaration of conflicts of interest. Is there anybody have a conflict of interest I'd like to declare at this time? Hearing none, we'll move on. Approval of the minutes. You've all seen the minutes from our October 28th meeting. Any issues, questions? No. Could somebody move approval? Marlis? Second, Hugh? All in favor? Great. Okay, thank you very much. We have several items on today's agenda, but with the year winding down, I thought it would be a good time to briefly recognize the progress that Alberta Health Services has made over the last 12 months under the leadership of Dr. Verna Yu and the entire executive leadership team. It's been a busy year at AHS. To recap just some of the things that have happened for the organization, we've created a new vision for the organization. We've refreshed its values, completed the rollout of the 4 foundational strategies, released our health plan and business plan. We've really bolstered all our community engagement efforts from the board level and throughout the executive. And we've, of course, in mid-year, extended a helping hand to tens of thousands of Albertans, and we are continuing to do that, who were affected by the wildfire in Fort McMurray. Beyond that, we've made progress this year towards strengthening our culture of compassion and patient-centered care. And we've also made significant strides in improving our engagement with communities across the province in various ways. I'd like to thank Dr. Yu and the leadership team and everyone in AHS for their efforts over the past year. I'm particularly pleased that our hardworking staff, physicians, and volunteers contributed their thoughts, ideas, and perspectives in an organization-wide dialogue that we conducted, and all of them have helped play an integral role in improving AHS for the better. The board is very grateful for that. Several items on today's agenda relate to the progress we've made over the past year. Today we'll consider a recommendation from Ethics and Compliance Office to upgrade the organization's code of conduct to reflect the new vision, values, and foundational strategies that I mentioned earlier. The board will also consider recommendations related to some of our community engagement activities. AHS has received 14 trustee appointment requests from 10 of our foundations, and they are coming to us for approval as well. The board will also review amendments to AHS's philanthropic and honorific naming recognition policy, which is important for our foundations across the province. The board will also hear from Finance, Audit and Risk, and our Human Resources Committee. Before we commence to that business, though, I'd like to invite Dr. Yu to update you on the progress of this season's flu immunization project. I'm having trouble with words today, as well as our workforce engagement and patient safety culture survey. Dr. Yu?
Great. Thanks very much, Linda, and good afternoon to everyone. Today, I'd like to share a couple of updates with you, as well as a video that illustrates what Linda mentioned earlier about a culture of caring and compassion. But first, let me start by updating you on our public influenza immunization campaign. As of November 26th, nearly 875,000 doses of influenza vaccine have been administered in Alberta. That's about a 4% increase, representing about 35,000 doses over where we're at the same time last year. So that's good news, and we're working hard to maintain this momentum. Less than 30% of Albertans were immunized against influenza last season, when more than 1,600 Albertans were hospitalized and 62 died with influenza. This season, we have enough vaccine to immunize 35% of the population, and we want to use up that supply. Influenza arrived early in Alberta this season. Between August the 28th and November 26th, we've had 374 lab-confirmed cases of influenza in the province, and 118 individuals with lab-confirmed have been hospitalized, one of whom has died. This is a tragic reminder of how serious influenza can be. So I encourage all of you to get immunized And if you haven't done so already, please go to your closest public health clinic. And if you can, please get the word out to Albertans about the importance of immunization. Local clinic schedules are available on our website at ahs.ca/influenza or by calling HealthLink at 811. Next, I'd like to update you on our People Survey, which was our internal survey conducted by Gallup that combined our workforce engagement and patient safety culture surveys. The month-long survey closed on November 24th, and I'm pleased to say that our participation rates exceeded those than in our previous 3 surveys back in 2010, 2012, and 2014. The most recent survey was completed by more than 40% of our employees, more than 20% of our physicians, over half of our midwives, and nearly a third of our volunteers. This is important because improved participation rates translate into additional information that we can use to better enable and empower our people. As I've often said, Alberta Health Services' greatest asset and resources are people. Survey results are expected in the new year, and I will share them with you at a future public board meeting. The results will inform the work outlined in our people strategy, which we released earlier this year in an effort to improve our workplace environment and to help make our people feel safe, healthy, and valued. So why is this important? Because we know that patient care, patient safety, and patient experience improves when healthcare providers are highly engaged. So when our staff, physicians, and volunteers feel safe and valued at work, there's also great benefit to our patients, clients, and families. I should point out that every day there are countless examples of where our staff, physicians, and volunteers are going the extra mile for the people we serve. So I'd like to share one example with you today. Sara Joan Armour of Medicine Hat left a message of gratitude on our Thanks for Caring webpage this summer. Her husband landed in hospital after a fall. Sara was overwhelmed by the care he received by his medical team, but also by the care and compassion shown by the hospital support teams, especially the nutrition and food services staff who brought him his meals. We reached out to Sara to thank you for her note, and she mentioned wanted to do something special for the food staff. We helped Sara with some arrangements, and this video really shows what happened next. So enjoy.
There was just enough snow to cover the ice on one of our neighbor's sidewalks, and we both slipped on the ice, and my husband broke his hip. He never was able to stand on his own, and that meant that I couldn't bring him home. My husband was a very avid reader. We didn't buy new books. We went to book sales at churches and the library and garage sales. And he was always very keen to see the books that I would bring back and check them over. And he liked to read cookbooks so he could tell me what I should try and make. I'm not a good cook, but I try. Well, I know if he was still with us, he would be there and would want to thank them, because he did appreciate their competency, their care, and their concern, and the fact that they were very friendly and smiling and made life more cheerful for him. The nurses and medical staff always got thanked, but there's so many other parts of healthcare, all of which are equally important. And the nutrition staff were probably the only people that the patients saw on a regular basis other than those who supplied the medical care.
So we've set up a tea. The staff don't know. They know there's a mystery guest coming. They're all abuzz. They've got theories of what's going on. I'm hopeful that they're really going to love it. And I'm just so excited myself. I can barely contain myself. Our staff are so dedicated and have such a passion for what they do. And I think to be able to come face to face and hear the words come from Sara today is going to mean a lot. Thank you for all of your hard work and everything that you do. It really made a difference to her and her husband while he was with us. And so I'm going to go and get Sara now and bring her back and have her say a few words to all of you.
And every day you came along and you were cheerful and you greeted all the patients by name and you asked them what they would like to have. And this made such a difference because they felt they could control part of their care, even if it was only what they ate.
I've been here 27 years, and this is the first time anybody's ever done that. It's a wonderful thing, wonderful to be appreciated.
To hear this story and just to be kind of involved and know that we made a difference is really inspiring. It's a blessing that she came in.
I always feel if my mom or my dad was a patient in here, how do I want them treated? So I try and treat the patients the same way as I would treat my own family.
So I really want to thank Sara for sharing her story with us because it's a wonderful story. It really confirms a belief that we all have, which is that everyone within healthcare, regardless of whether you're a physician or a porter or a nurse to food services staff, that we all have opportunities to make a positive difference in the lives of others. And it's clear that the Medicine Hat staff profiled in this video care about the work that they do and see themselves as part of the bigger health system. I'm also really heartened by one of our staff's comment, Judy, who said that she strives to treat patients like the way that she would want her own family to be treated. By doing so, she's embodying the AHS values of compassion and respect and providing the sort of patient and family-centered care that Albertans deserve from us. This month, we'll have staff, physicians, and volunteers working over the holiday season to provide care, compassion, and companionship to Albertans across the province. I'd like to recognize their efforts and thank them for their efforts and for treating patients and their loved ones like their family, not just during the holidays, but throughout the year. I also like to thank all of you for your continued interest in Alberta Health Services. As Linda mentioned, it's been a busy and productive year for the organization. And although we've accomplished many things over the past 12 months, we know there are many more opportunities and challenges that await us in the new year. So thank you for spending the afternoon with us, and I wish you all a safe and happy holiday season.
Thank you, Verna. All right, next item on the agenda is our Governance Committee. Hugh?
Thank you, Madam Chair. I get to follow that uplifting video and message with the excitement of governance. The Governance Committee last met on November 24th as part of our review of all the governance documents of Alberta Health Services. We specifically reviewed the Regional Health Authorities Act, which is the foundational governing legislation for AHS. As well at our meeting, the Chief Ethics Officer attended to give her quarterly update. In addition, she presented some proposed revisions to the AHS Code of Conduct. Now, in general, the Code of Conduct revisions are somewhat of a housekeeping nature to include references to the new vision, values, and foundational strategies of AHS. On reviewing these, the committee has recommended to the board that the board approve the revised Code of Conduct with some minor amendments suggested by the committee. Accordingly, I move that the Alberta Health Services Board, A, approve amendments to the Code of Conduct in the form reviewed by the Board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And B, authorized and direct management of Alberta Health Services to make the amended Code of Conduct available to the public through the Alberta Health Services website. And that is my motion.
Marcus? Any questions? All in favor? Thank you.
And that's all from governance at this point.
Audit and Risk Committee. Glenda?
Madam Chair, and I'm pleased to give this report on behalf of the Chair, David Carpenter. The Audit and Risk Committee met on November 25th, and as we usually do, we had representatives from the Office of the Auditor General and the meeting. We reviewed the audit plan for the 2016-17 fiscal year. We were presented with audit reports for review as well as the legal and privacy annual report. And there are no items that from the committee.
Thank you very much. Human Resources Committee.
Good afternoon. So the committee met on November 28th. We had a number of presentations from staff. These presentations covered an update of the people strategy. In particular, we got an update on where we were on labor relations and the implementation of the essential services.
I know these were important words that were probably not captured. So if because this is important and I want to be sure that it's captured. So I will continue. It received also an update on health and safety and an overview of workplace violence prevention. The committee did not have any matters for approval, and all the items were for information and discussion.
Thank you very much. Community Engagement Committee, Brenda?
Thank you, Madam Chair. The Community Engagement Committee met on November 24th. They were provided highlights from the Fall Forum for Health Advisory Councils, Provincial Advisory Council, and the Wisdom Council. The committee heard about internal strategy work underway with the Community Engagement Group. Mr. Ken Matthews, the chair of the Lesser Slave Lake Health Advisory Council, attended the meeting and gave a very interesting presentation on what he perceives as opportunities, results, and challenges in healthcare in his area in Lesser Slave Lake. Amendments. The committee was also presented with a revised philanthropic and honorific naming and recognition policy. The policy is a board policy, and any amendments will need board approval. The committee recommended the board approve the revised policy, and accordingly, I move that Alberta Health Services A, approve the amended AHS philanthropic and honorific naming and recognition policy in the form reviewed by the board with such non-substantive changes that management of AHS considers necessary or advisable, and B, authorize and direct management of Alberta Health Services make the amended policy available to the public through the Alberta Health Services website. I so move.
Seconder? You? All in favor? It's passed.
The second thing the committee discussed was appointment of trustees to health foundations. The responsibility to appoint trustees to established foundations lies with the AHS board pursuant to the Regional Health Authorities Foundations Regulation. The committee reviewed the appointments to certain foundations effective December 8, 2016, and recommended that the AHS board approve such appointments. We are very grateful for the commitment of our foundation volunteers across the province. We value their work and appreciate their commitment to health care in the province. Given the number of appointments, the names will not be read at this meeting, but will be incorporated into the minutes of the meeting and posted publicly. Accordingly, I move that the Alberta Health Services Board approve the trustee appointments or reappointments to the foundations effective December 8, 2016, as reviewed by the committee and the Alberta Health Services Board. I so move.
Seconder? Glenda? All in favor? That's passed. And Finance Committee. If you put your mic on, then you can speak.
Thank you. On behalf of Mr. Carpenter, Chair of our committee, I would like to present to this meeting the 3 items for approval. First one is the second quarter investment report. This was discussed at the November 25th meeting of the committee. As mandated by AHS investment bylaws, the Finance Committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS's investment portfolio on a quarterly basis. The Regional Health Authorities regulation and the AHS investment bylaw describe the requirements for the board to approve or ratify by resolution AHS's investment decisions. The Finance Committee of the board was presented the September 30th, 2016 second quarter investment report and recommend to the board to ratify the transactions. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions described below and as certified by signed investment compliance certificates from AHS and Phillips Hager North Investment Manager. A, as at of September 30th, 2016, AHS held restricted and unrestricted funds managed by Phillips Hager and North Investment Management, Standard Life Canada, totaling $1.462 billion. B, the funds were invested in short-term treasury bills, federal, provincial, corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian and global equity funds. And C, all the funds invested during the quarter ended September 30th, 2016 were invested in accordance with the investment bylaw and investment policy as certified by signed investment compliance certificates from AHS and Phillips Hager North Investment Management. I have finished that first item and I have moved.
Could you read it again?
I can do this in French.
So moved. Do we have a seconder? Glenda, second. All in favor? Good.
Thank you.
Thanks.
Yes.
Now for the second item. Protective Services contract extension with the Paladin Security Group. The contracted services with the Paladin Security Group provides the 2 HS facilities. That contract is expiring. The Finance Committee recommended that the board approve the extension as reviewed by the committee and delegate signing authority of the contract on behalf of HS to the President and CEO. I accordingly move that the Alberta Services Board, A, approve the 1-year extension to the current Paladin Security Group contract, and B, delegate signing authority of this extension to the President and CEO.
So moved.
Is there
Seconder?
seconder?
You? All in favor? Carried.
I have a third item that the committee considered, which was the delegation of authority over $90 million master services agreement. Finance Committee reviewed the amendments to the master services agreement with Villa Marguerite Seniors Community Partnership and Shepherd's Care Foundation. The amendments exceed the approval and signing authority level of the President and CEO and therefore needs to be approved by the board. The committee recommended that the board approve the amendments as reviewed by the committee and delegate signing authority of the amendments on behalf of AHS to the President and CEO. Accordingly, I move that the Alberta Health Services Board, 1, approve the amendments to the Master Services Agreement with Villa Margaret Seniors Community Partnership and Shepherd's Care Foundation, and 2, delegate signing authority of each amending agreement to the President and Chief Executive Officer.
Could I have a seconder? Glenda? All in favor? Carried.
This concludes my eloquent report.
Thank you very much, Richard. Thank you, everyone. I just would like to say, since this is the final board meeting of the year, thank you again to everybody at AHS for an enormous amount of work over the past year. I think the organization has made great progress and continues to do so. And I'd like to say thank you to my board colleagues for all their hard work and support. And I wish everybody a safe, happy, and healthy holiday season. Thank you very much. We're adjourned.